When you're completely committed to caring for the heart, it shows.
You'll see in Arkansas's largest group of cardiologists.
And recognize it in the state's most experienced heart surgeons.
It's reflected in the skilled nurses and the latest technology.
In hospitals staffed with all the other specialists that heart patients need.
They put all their hearts into caring for mine.
St. Vincent Heart Clinic, Arkansas, and the Jack Stevens Heart Institute.
And now, The Heartbeat from the Jack Stevens Heart Institute at St. Vincent.
In today's St. Vincent Heartbeat, we meet a man who is searching for answers after his son and daughter are diagnosed with a congenital heart problem known as bicuspid aortic valve.
Several years ago, Will Campbell left his legal profession behind to pursue a job as a tennis instructor in Little Rock. And like father, like son.
My son, who's going off to play college tennis at DePaul University.
But Will may have passed along more than just his love of the game.
He went in for a routine physical examination, and the cardiologist, or the pediatrician rather, caught a heart murmur.
In a young person, usually a heart murmur is not a normal thing. And somebody that's older, we hear innocent heart murmurs all the time. They're to be expected. A little mild valvular leakage is not a problem. But in younger people, it's fairly unusual.
Further testing revealed Will's son has a bicuspid aortic valve like this one, a common congenital heart abnormality that can run in families.
Aortic valves are typically tricuspid. They should have 3 leaflets. His only had 2, and that puts him at risk for valvular problems down the road.
Then he came and saw Dr. Borg and got a transesophageal echocardiogram, and that revealed that his leakage was relatively mild, and it probably wouldn't impact his playing college tennis. After that, Dr. Borg recommended that my daughter Elizabeth be tested, and it revealed she had the same bicuspid heart valve defect.
Today, Will is having an echocardiogram to find out if he may have passed on the genetic defect.
So what we're looking at here is your aortic valve. We're looking sort of down the barrel at it. So
good news for Will, his heart is normal, but it still doesn't provide answers for his son and daughter. Both will be monitored, and as long as they're asymptomatic, tennis can continue to be a family hobby.
Most of the time, bicuspid aortic valve causes no symptoms, but some signs to watch for, especially in children, include chest pain, difficulty breathing, pale skin, and a child who tires easily. For today's St. Vincent Heartbeat, I'm Jancy Sheets.